And the 2300 milligrams is recommended for persons with normal blood pressure. As Dr. Cox said, normotensive. You don't have a blood pressure issue or the other diseases that I'm going to list. And for those persons 51 years and older, or of black descent, or have high blood pressure, or have diabetes, the recommendation is 1,500 milligrams per day. So if 2,300 milligrams of sodium is found in 1 teaspoon of table salt, how much would be 1,500 milligrams of sodium? Just about half. Just about half. Roughly. Other diseases such as congestive heart failure, liver cirrhosis, and kidney disease may need much lower amounts. So that would be advised by your physician, your healthcare provider, your dietitian. Let's look at some sodium terms. Monosodium glutamate, what is also known as what? MSG. And what does it do? It's a flavor enhancer. So is it just for the savory foods such as the meat kind and so forth? What else they use it for? Chips? Yes, so chips, your meat kind, what else? Sausage, fried rice. And it is also used in certain beverages, believe it or not. Certain beverages, certain milk beverages, it helps to enhance the taste. So, and then you may not always see MSG on the label. You may see other names as well, like glutamate, something or the other, you know. So you can just look out for some of these names. And let me go through the list. Disodium phosphate. It helps to quicken cooking time for cereals, and it thickens certain desserts. Even condensed milk and those sorts of sweet items, it helps to thicken those. Sodium alginate is a food emulsifier and thickener. Sodium benzoate, preservative for certain foods, such as dried fruits. So sometimes you may go and purchase the dried fruits and you're thinking it's healthy. Dried fruits in itself is healthy, but anytime you purchase a product that is not prepared at your home, that you didn't pick from the tree, in your yard, or from your garden, always check to see what else is with it. Always very important. And sometimes I'm a little cautious when I purchase items that are taken from a bigger package and packaged into smaller packages and sold to us, because there's no label to really tell you what the contents are. Sometimes it's difficult to do better, but if you have a better option, that is always my recommendation. Sodium hydroxide, otherwise known as caustic soda. And you know, it is prepared in different strengths, varying strengths, because caustic soda can be very, very strong. It can actually burn the skin. But in terms of food and food preparation, I suppose they have used lower quantities or strengths or concentration of caustic soda. But it is also used in food production. Sodium nitrite. And this is very popular. You know this. It is used for curing and smoky taste to foods. Example, the cold cuts and sausages. A matter of fact, some people, if they order, for example, they order a burger, they won't eat the burger unless bacon is in it. Right? So some people are hooked on the smoky taste, believe it or not. If they prepare egg, they must have a piece of ham, a piece of bacon, a piece of smoked something in it, piece of smoked herring somewhere in the cooking, because they are hooked on that smoky taste. Sodium propionate, and otherwise you may see it represented as E281. It is a preservative and a mold inhibitor. means that it delays or prevents the growth of mold in your food. So it doesn't become moldy. And I always say, anytime you see a product that has a long shelf life, be careful. 5 years and 6 years and, long story. Right? So it's very important to be conscious of this. And again, I always say, I won't tell you not to eat this or not to eat that. Because sometimes the situation does not allow to make the healthiest choice, but I always say make the best choice possible. For example, if it's hurricane time, and hurricane came and it blew all the vegetables out of your garden, and everywhere is broken down, and you can't even get out of your area for some time, what are you going to do? You probably would have had some stores, something there stored up so that you can consume. So always make the best choice possible. But if this were an ideal world, and it's not an ideal world, but if it was an ideal world, we would consume only things grown in our garden and from our fruit trees, and we would prepare our food just like in the good old days. Only a few items would come on the boat, and they can't stay very long because the weevil would consume it, all of, that kind of thing. Nowadays, can you imagine this? You buy a cake with nice frosting on it, and not even the ants trouble it. Doesn't that say something to you? Yes, even nature itself knows what is not good for it. So it's very important for us to learn from these little creatures in nature, right? And even if I go to the supermarket or the market, and I see spinach and there's a worm leaf on it, I would purchase that spinach over something that looks flawless. Because that means that there would be less pesticide, herbicide, whatever on that particular product. So that's something to learn from nature. Sodium sulfite is also a food preservative. And persons who are allergic to sulfur, this may be something that you can look into. Sodium saccharin, artificial sweetener, such as gums, even the toothpaste. You notice the toothpaste tastes sweet? Yeah. Yes. Cookies, baked goods. Sodium bicarbonate, baking soda, it is used in baked goods. And sodium bicarbonate can be used for other things. For example, some of us use it to give our teeth a nice little polish, that sort of thing. So these are some sodium terms. I hope you wrote them down so that you can go, when you read labels again, check out the labels, see what they're saying, and see if this is an alternate name used on the label to signify to you that sodium is contained in that food item. Here are some additional tips to reduce hypertension, because you would have been presented with some tips prior to my presentation. Decrease overall salt intake. And sometimes we don't realize how much sodium we are consuming until we taste something different. For example, the bread that we purchase in the store, at the shop, usually contains high level of sodium. And how by just tasting can you tell? When you go home and prepare bread without salt, you taste how bland it is. How bland, sometimes it has a little off taste to it, because you are so accustomed to consuming the high sodium levels in our local bread. And not just salt that's added, but sometimes the butter or the margarine contains salt in itself, so that's additional salt there. Utilize fresh herbs and seasonings. And tonight I have a presentation for you, and all I did was utilize garlic and red onions and whatever works for you, because some people, onions might not be best for you in your diet. For example, if you have acid reflux, so you use the herbs that you can tolerate. Use lemon or lime juice to give your dish some zest, and you find that it helps. If you need to lose weight, discuss this with your healthcare provider so that you can get started on a meal plan. And if, for example, your husband or your brother or your auntie or mommy went to the dietitian and got a meal plan, not a diet sheet now, a meal plan, thou shalt not borrow your neighbor's meal plan, because it is specific and unique to them. Okay, amen? Amen. If you smoke, get some assistance to help you quit smoking. Very important, because smoking has some correlation with hypertension. If you consume alcoholic beverages, limit intake, 1 per day for women and 2 per day for men. Somebody asked a question earlier about that. Now, what I should mention is that don't do like when you're saving up for Christmas at the credit union. For example, I decided this week I'm not going to have any alcohol, next week none, and then month end is my birthday, so I'm going to drink off an entire bottle for myself. It doesn't work that way. Just like Dr. Matthias said, your medication, you decide not to take it today and not tomorrow, and then the blood pressure high in the sky and you want to double up. It doesn't work like that. Okay? So you still have to stick with the recommended 1 drink per day for women and 2 per day for men. And a matter of fact, the best recommendation is no alcohol at all. When people cessate their alcoholic consumption or alcohol consumption, they realize that the blood pressure levels tend to get back in shape. Exercise at least 150 minutes per week, not more than 2 days in between exercises. So if you went to exercise Monday, Tuesday, Wednesday, and you decide, I'm going to take a little break, Saturday should be the next day. So you shouldn't allow 3 days to pass in between, or however